sometimes childhood apraxia, speech apraxia can affect the entire body, not always. It could be hard for a child to plan out what they need their hands to do, what they need their legs to do, and to coordinate those movements throughout their body. So your child might have difficulty with things like holding a pencil or learning to write. They might have difficulty with some gross motor, which would be maybe it's using the bigger muscle groups. So it might impact crawling or walking.
Research shows that 50 to 80% of children with CAS have fine and gross motor deficits. Often these will go undiagnosed. Developmental coordination disorder, or DCD, is a neurodevelopmental disorder and is present in about 5 to 6% of the general population. But it seems to be much higher in children with other neurodevelopmental disorders such as autism, ADHD, developmental language disorder, and CAS. To be diagnosed with DCD, it needs to be determined that the difficulties are not the result of another type of neurological disorder, a visual impairment, or a cognitive or intellectual disability. And the diagnosis is generally not given until after the child is 5 years of age. Children with DCD will acquire motor milestones much later than typically developing children, with the onset of the symptoms occurring early in development. Difficulties we might see could include general clumsiness, slowness, and inaccurate motor movements in tasks such as cutting with scissors, throwing and catching a ball, handwriting, riding a bike, or participating in sports or other physical games. These difficulties will impact activities of daily living, such as teeth brushing or cutting with a knife and fastening clothes, as well as academic and school success and play. There can even be secondary impacts on mental health and social skills, which can lead to behavioral issues. As clinicians, when we see signs of gross and/or fine motor difficulties, we need to refer these children to a PT or OT who is familiar with appropriate testing for children with severe speech and language difficulties.
And so for those concerns, an SLP might refer out to an OT, and they might be someone, an occupational therapist. They might be someone who can help with handwriting or just using the fine motor movements of the fingers. And then they could also refer out to a physical therapist, a PT, who would help with crawling, walking, and those bigger, larger movements.
So we see that some children with CAS also have concerns with sensory processing. So it seems that their brain is having trouble receiving and responding to information that's coming through their senses. So sometimes we see that they're over responding. And so they're very sensitive maybe to sounds, noises, textures, things like that. And sometimes we see that they're under responsive to those things. So sometimes they're up here and sometimes we see them down here.
So sensory processing disorders can impact a child as well. And we might see this, it can really show up in a number of different ways.
So some things you might see, again, sensitivity to like bright lights, or you might see really like a lot of seeking input. So you might have a child who's like running into walls, crashing into furniture all the time. Sometimes we see feeding issues. So we have, very picky eaters who are very particular about textures and things like that. And sometimes we'll see too, like differences in responses to pain. And it also just has to do sometimes with activity level. Like if we're seeking input, moving very quickly from thing to thing, or if we're kind of not seeking a lot of input and really trying to avoid, those are some things that we typically see.
It could impact their ability to sit down and stay focused.
And so we want to try to adjust our input so that they're kind of more at a steady level where they're able to learn and respond to us more in the ways that we're wanting them to.
And for therapy, for childhood apraxia of speech, we really need the child to be engaged with us. And so if their body is needing some more input or information, we we might need to incorporate that into therapy or get them ready for that before therapy so that they have the ability to then sit and focus and attend. And so an occupational therapist can be a great resource in either helping provide some tips and strategies and things that we can do in order to prepare for the session, or things to do during the session while we're working on our sounds and words that we're producing. We might be able to incorporate some of those things during our session. The child might also need to go for therapy with an OT to work on some of those difficulties that they're having.
We definitely want to refer to an occupational therapist if we're seeing signs of that, and work with an OT or possibly co-treat to help, again, get that child to that ready learning state where they're the most regulated and most ready to learn.
So a child who's working so hard and isn't able to yet maybe communicate everything that they want to say could really have a hard time making friends and keeping friendships. And this can be really challenging for the child and also the family.
The big pieces that I feel like we need to really hone in on for our research and find ways to support our kids is in that social-emotional development. Dr. Tricia McCabe out of University of Sydney a few years ago looked at adults with CAS and their responses to kind of how they viewed themselves growing up and how they viewed themselves now. And what she found was that a lot of our kids don't have great self-esteem. They don't see as much worth in themselves as they do in their peers. They also reported maybe not thinking that they were able to have as strong of a career as some of their peers due to the self-esteem of growing up with CAS. If we look at, especially, I would say, first of all, with girls, that first original development that we have socially when we start playing with one another in kindergarten, it's past preschool, is there's a lot of, interactive, imaginative, conversational, language-based play. So if you're a girl with CAS and you're struggling to keep up with that conversation, it's going to be challenging to integrate. Boys, and I'm being a little bit like girls versus boys and whatnot, but in generalities, will tend to, maybe play ball or have like a little bit less language involved play in those early elementary school years. So that might be easier, but it is going to be more physical play. And a lot of our children with CAS might also have difficulties with motor planning, limbs, just global difficulties. And so therefore integrating with those kids in a more active manner might be more challenging for them.
So I think it could be really important to refer out to a therapist for maybe the child or the family so that the child could gain some more confidence and learn how to interact with other peers. And also it could be great to do some therapy that is with other children who may be speaking, may not be speaking, so that the child gets some practice in a smaller group rather than being in a larger group at school, where they can practice using the words that they have and that they've mastered, or perhaps using their communication device if they have one, or using any signs, gestures, or any other augmentative communication device that they might need.
One of my patients has said to me, I have something I want to say, but it goes too fast and I can't say it then. And so we've actually gone into the classroom and he and I have put together a presentation for other kids so they can understand what is CAS and what does it mean by him not talking as much or always saying yeah, and what he wants them to know. And one of the things that he wanted them to know was, just because I'm not adding to the conversation doesn't mean I don't want to be a part of it. We don't know yet how to support these kids in their social emotional journey, but it's an area that I'm excited that research is starting to look at. And I think that we as professionals and as parents need to always be thinking about that.
Children with CAS do have some struggles with literacy and learning to read phonological awareness skills. In particular, we see that they have a lot of trouble with rhyming and some of the other phonological awareness skills.
One of the things that I see as being one of the most difficult parts is almost a cascading effect of the apraxia. So often our children with apraxia are still learning how to speak when other kids have started to transition to learning how to read. And so when we've increased through therapy their verbal skills, they are starting to learn how to read when others may have transitioned to reading to learn. So that cascading effect of the impact of where their development is can impact, a child as they go on.
Because if you're thinking about reading and writing, that is the written form of our sound system. And so the pre-literacy years are years spent understanding and playing with and really developing a strong sense of our sound, of our oral sound system. And then to ask children who haven't had as much time to develop in that area to then go and put it into a written sound system or a written form of our sound system is challenging.
Phonological awareness is the recognition that words have sounds in them, and how can we change those words around. So some of the activities that children are doing when they're working on phonological awareness, like rhyming, sound identification, blending, segmenting, manipulating, and letter sounds, can be more difficult for a child with apraxia. When we have a decreased amount of speech sounds, how do we start to work on the sounds of the word when we're unable to successfully produce them? Or sometimes those sounds may come out differently. We see those inconsistencies, or we see those errors.
One thing that really stood out to me is Nathan et al. In 2004 did a study, and in that it says that 50% of 4-year-olds with isolated speech difficulties show poor reading and spelling performance at 6 years, despite improvements in speech production. And that's such a huge statistic to me. So 1 in 2 children, if they had any kind of speech difficulty, is still going to show some difficulty with their reading and writing in 1st grade. So if you think about our children with CAS and how they haven't gotten to have nearly the practice with those speech sounds and with our sound system, then I would hypothesize that that number is even higher for our children with CAS. I was looking at some of the other pieces, and it said specifically for children with CAS, McNeil et al. In 2007, or this is 2009, it says, compare the phonological awareness decoding and letter knowledge ability of children with CAS, children with inconsistent speech sound disorder without oral motor impairment and typical speech development. And children with CAS exhibited inferior phonological awareness and had more children performing below average on standard letter knowledge and decoding measures than other groups. Furthermore, Lewis et al. In 2004, the children with CAS exhibited more severe decoding, spelling, and reading comprehension difficulties at follow-up than the other 2 comparison groups. So overall, we know that children with speech sound disorders struggle with written language, even more so our children with CAS struggle even more so.
So we want to start working on those skills as soon as the child's ready, as soon as it's developmentally appropriate, which is between 4 and 6 for a lot of children. There are things we can be doing before that time.
When we work on those skills early on, we give children the best chance that they'll be able to learn those skills along with those peers. So whether the phonological awareness is worked on by the speech and language pathologist, or they're worked on in special education with a teacher, we need to incorporate those within our sessions, because children need to learn how to manipulate those sounds of the words or to be able to make rhyming.
The other issues that tend to come up a lot with learning to read are both about like the type of reading instruction that's being given, and then also the emphasis on children who are learning to read, being able to read out loud. So because many of our children with apraxia are struggling with their productions, that can definitely make it more complicated to know if when they're struggling to read out loud, what is the cause of that? If that is more truly the reading skills, or if that is being complicated by their ability to produce speech. So there are definitely some things we can do to help problem solve through that, and such as giving the child other ways to respond besides speech, and to be able to demonstrate some of those phonological awareness skills and literacy skills.
And we need to give them other opportunities to identify those. So from some of my children that are still having difficulty having enough verbal speech, I may provide pictures of, okay, can you show me the picture that rhymes with money? And then I can give them a picture, 3 options. Can they identify that money and bunny rhyme? And so what can we do to be able to access what is their strengths while also providing some of those skills? Children with apraxia often have comorbid diagnoses that continue on to impact them educationally. So while we think about apraxia being a speech sound disorder, we know that as they get older, we are often seeing other comorbid diagnoses. When we think about apraxia being difficulty with the planning and execution of the speech sounds, we sometimes also see those continuing on to impact, their reading, their writing, their ability to socialize.
When we're looking at academics and we're thinking about our school-age children, in the beginning of school, there's this huge focus on learning to read. In the middle of our school-age children, everything changes from learning to read to reading to learn, right? And so if we think about our children with CAS being at large risk for having difficulties with literacy, those first couple of years of school are so focused on reading. And if reading is challenging for you, those couple of first years are going to be a struggle. And also that's when kind of kids start to see, oh, he can read and she can read, but I can't read. And so that social-emotional piece comes into it as well. Then when we get to like 3rd grade and suddenly we're supposed to be able to read and we're supposed to use that knowledge of reading to go ahead and read our social studies and our science and our different books and take that information and synthesize it. Well, now we're taking a child who's struggling to read and then having to go and apply their knowledge of reading to gain access to the curriculum. When we're looking at academics, everything can be hindered by that written language development. And then not only are we learning through reading, but we're also giving written responses. And so that spelling, that writing, that putting together of sentences is part of our written language as well. So it's not only going to happen in our language arts, the child might struggle, they also might struggle in all their other social studies, science, whatnot classes because of that written language piece as well.
See dyslexia, we could see dysgraphia, we could see developmental coordination disorder, we could see difficulty with executive functioning. One of the things that I've noticed often in my practice as children get older, they have a more difficulty with the narrative language. Apraxia often have difficulty with multisyllabic words. As kids get older, when we look at the vocabulary that's within the classroom setting, they're not simple words, but we're looking at a variety of different words. So it's important to make sure that the teaching staff and the speech and language pathologist and the parent are working together to identify difficult words and help provide support. So often as kids get older, when we're looking at those multisyllabic words that come up and they're so unique to whatever they're learning, what can I do as a speech language pathologist to support that child so that when they're having a discussion in class, that they're not concerned that they can't say it correctly or they don't have the correct motor plans for it.
Now, luckily, we are in a time where there are different things like Reading Ally, where you can get the textbooks where, on like audiobook for you and whatnot. But that still takes, the parent advocating for that and getting all of that set up.
I also see as children get older, we need to incorporate other team members. And so often when I start working with a preschool student, it may just be me as the speech and language pathologist working on it. And so I may target the speech sounds as well as the phonological awareness. But as we move on, we need to make sure that the special education staff or school psychologist or the guidance counselor or the teacher, that we are all working together to determine not only the impact of the possible childhood apraxia of speech, but what other things can we be on the lookout for. It's far easier to be proactive and see what we can put into place early on than to be reactive. A child who has a diagnosis like apraxia is more at risk. So what can we do as a community or as a staff in a school system to be able to identify it early on and provide those early services in hopes that we can get them where they need to be early on. It's important to meet the child where they are, but it's also important to provide the support to the classroom staff as well.
Thank you so much to all of our wonderful Apraxia Kids Boot Camp graduate SLPs for sharing their experience and expertise with us. We learned so much about different comorbid disorders that children with apraxia may face along their journey. There is a lot to think about, but being prepared to recognize these potential challenges so they can be addressed early will better equip our apraxia stars to be successful across all areas of their lives. Scan this QR code to find more information in our parent portal about comorbidities, including a webinar about understanding the whole child, an article exploring autism and apraxia, and articles about other professionals who may need to join your team. Scan this QR code to explore more of the parent portal. Throughout the pages for each age and skill level in the parent portal, there is specific information about each of the topics discussed in this vlog. As you explore each age and skill group, you will find a menu that includes support and social skills and developmental, academic, and learning challenges. You can find a variety of information and resources for developmental coordination disorders, fine and gross motor skills, sensory processing disorders, social skills, and literacy and academic difficulties. Specifically, on the 0 to 3 years page, you can find 2 webinars about motor skills and autism, and articles about sensory processing disorder and epilepsy. On the grades K through 3 page, you can find information explaining testing for comorbid challenges and information on literacy struggles. Keep exploring the Apraxia Kids parent portal to find more about comorbid challenges. Through our parent portal and through videos like this, Apraxia Kids is giving hope by providing information and education to support families throughout their apraxia journey and any challenges they may face along the way.